We collaborated with the Nigerian Army last year. Very good outing. You know, the men, we've noticed that a lot of men come down with prostate cancer. And you know, our men now, they are the pillars of our home. They're running around looking for school fees, looking for money to buy hair for madam, looking for how to clothe the family. They go through a lot. So most times they suppress their illnesses. They don't speak out on time. So we now looked for a group that is less likely to come out. Remember, being a soldier, you're always on the road. The little time they have, they want to spend it with the family. They rarely come out. They'll just keep managing and managing. So we went to the Nigerian Army. We went to the commandant there. We discussed with the higher officers there, and he collated their officers. We had about over 500 people seated when we got in, and people were still being pulled from service point to come in. We told them about their health, focusing on their prostate because it's something that worries us. So when we talked to them, they came, we screened them, and those that needed treatment, we followed up and continued. So we work with women, children, men. And during our teachings, even though we're female doctors, sometimes we'll have an expert in a particular area, the men. They go with us. Because if the woman is healthy, the child is well, definitely the man of the house will be happy. So we have men for women. We call them the he's for she's. The male doctors support us. We also get experts in other areas. The Nigerian Police, Army, road safety. We work hand in hand just to create awareness and screen and also treat where necessary.
Can you tell us the challenges that female doctors face and how MWAN is actually tackling these challenges?
It's not easy being a doctor, even if I say so myself. I think I remember the words of my teacher. He said, "You're expected to be an island of calm in a sea of chaos. You're thrown with, you see sick people every day, you manage them. Many times you save people, sometimes you lose people. So your emotions are all out there, but you're not expected to join people and cry and all that. So a doctor goes through a lot. That's why sometimes I look at you and say, you get mind. But it's part of the training. If we break down before the patient, now waiting the patient at 100. So we as doctors go through a lot. No, we are looking at all those things that a good doctor is going through. You think about what a woman is going through. You're battling your hormonal issues, PMS, menstrual period depression, all of them are pouring hormones on you. You have families to take care of, your husband, your children, the family you're coming from, your parents, your siblings, your village church is waiting for you, CWO, your town church is waiting for you, your streets group, other groups and coalitions. So you add the problems of a doctor and the problems of a woman together. That's what is waiting for a female doctor. So this group, as MWAN, we came together to provide welfare for our people. There are other welfare packages somewhere, but this is tailored to us, making our members find it easier. We provide welfare for our members. We as women, we also know the peculiarities of the problems facing women and children in town. So that is why most times it looks like our mission is tailored to us, improving health for women and children. Because we understand, we're better able to approach these challenges that women and children have. We're doctors, so when you come, we're not just seeing you as a doctor. In fact, our slogan says healing with the love of a mother. We're not just treating you as a doctor, we also treat you as a mother, because that's who we are naturally. We tackle these challenges they have by our membership. We have a branch of association that we call the YDF, the Young Doctors Forum. So for these younger ones, we don't wait for you to become a doctor. We want to get you when you're a medical student. We want to know your problems. We want to know the challenges you're facing. And not just that you're trying to be a doctor somewhere. Some of them are trying to start small relationships that may end up in marriage. Some of them are trying to make a decision about their career. So what do? We match these medical students to older, better established doctors. Do you understand? With time, in everything you do as a human being, as you grow older and work over time and time again, we learn from your mistakes. You learn from experiences. These students, they become mentors to these older female doctors. So in research, we'll have a research club, we'll have mentors there, and we ensure that they are ready before they get thrown into the world.
Can you tell us one of the major sicknesses that women face, they are prone to get in this region?
One is hypertension. Hypertension, being a black person, you're already a high-risk person. And then we do a lot of, God forbid, I jump and pass, it's not my portion here. When you ask someone, Madam, your BP is high, is anybody in the family that has? They say, no, everybody in my village is fine. Where we don't used to be sick. So because of our poor health-seeking behavior, many people don't even know the family health history. So we encourage people, just check, know your BP, know your figures. We started a campaign last year, our Young Doctors Forum. We call it Know Your Numbers. It's scary when you check 10 and up to 4, your figures are high. And if you know, it's easier for you to take care of. Number 2, think about breast cancers. That breast you're trying to cover, when it gets serious, it's from the gate you start opening the buttons. So we want women to learn how to examine their breast. just know when to examine and know what you're looking for, because it's usually scary, but by the time the woman comes in, it's not just restricted to one breast, it's in the second one. It has moved to your chest. Once it spreads, as doctors, we will not tell you, madam, na die you go die. We are supposed to also take care of your mental health, so we take it easy. Be like, we see what we can do. So if women check on time, if you see something on time, you talk and it gets removed. And another thing is cervical cancer. Being a young lady, you matched with this man, you got married, you have children, you start struggling all through this, trying to train these children. Just when you start having faith, maybe I'm about to conclude training these children, you notice that you have a vaginal discharge. It's foul smelling. You have sex with your husband, blood comes out, and you're not menstruating. So when all these things come up, the woman now waits. She drinks paracetamol, she does this, she prays about it. You are wasting time. We're losing time that is of essence to us. And by the time you come back a few years, it has spread. The woman has lost weight. She's going through a lot. But these are things, and people are coming late. That is our major worry. So we want these women to learn about these things a lot. Why not learn about it? Know the modifiable risk factors. When you say modifiables, the risk factors you can do something about. If you have a daughter, maybe you're already sexually active, you have a daughter, vaccinate her so she doesn't stand the risk of getting it in the future. Our mental health.